Hi everyone, welcome back to my channel. My name is Jaleesa. I'm a registered nurse and I work in cardiac ICU. I am a ADN and BSN prepared nurse. I wanted to come on here and talk to you about some study tips that you can use to excel in your nursing classes. Because nursing is hard, but it's not impossible. And I hope that with these tips, you can be more prepared, relax a little bit more, and ace all of your exams. To buy a recorder, you can use your phone as a recording device. You can actually go out and buy a recording device because it is so difficult to listen to your teacher or your instructor and then write notes, because it is so easy to miss stuff. I used recorders for the entire 5 semesters that I was in nursing. I also would encourage you to not spend an entire day just studying, because there's a lot of material that you need to go over and a lot of material that you need to know, because a lot of the exams are select all that apply or choose the one that's most applicable to the patient. And all of those may be applicable, but which one is the most? Which one applies the most to this patient? And if you spend a lot of time all day studying, those can get really jumbled up. So I would suggest that you study 20 minutes at a time. That leads me to do not cram the night before the test. Use those 2 weeks you may have for a test and study each day. And you say, that's just not my thing. I'm a person that studies the night before the test. Well, this is nursing school. You can't study the night before the test. Trust me, I know. I have a bachelor's degree in another field. I studied a day or two before the test. I was good. Made A's and B's on my test. I was fine. Can't do that with nursing school. So take my advice. Don't study the day before. I do agree that having study groups is fantastic, but I would suggest before you go into a study group that you study first and bring what you've learned to the study group, because you may not have mastered a concept or understood some material, and one of your nursing classmates may have understood the material that you're struggling with. And so you can ask that person, hey, can you kind of explain to me what you've learned? And what to do with a study group is you all learn what you couldn't learn on your own. I had study groups and I went between a couple of study groups because some of those just were not for me. Get together and review. Don't get together and study 2 weeks of material. Buy a NCLEX book. That is something that I did my second semester, and I wish I would have done it my first semester, because I was introduced to a lot of concepts that first semester. You learn a ton of meds, you learn a ton of disease process, you learn a ton of patient care. And if you get an NCLEX book, you're able to familiarize yourself with some of that stuff the first semester, so you're just not overwhelmed, because a lot of my classmates were overwhelmed that first semester and a lot of them did not make it, and I don't want you to be one of the ones that did not make it. So get an NCLEX book and use it to familiarize yourself with a lot of the concepts, and then use it for each semester. By the time NCLEX comes around and you're starting to study for that, maybe you're doing ATI, maybe you're doing Hertz, maybe you're doing Kaplan, or whatever you decide to do, you have all of that information already. You're just trying to review. You're not trying to cram. So the last thing that I would suggest is to get a good night's rest before your exam. Have a good dinner, relax, watch some TV, binge watch some shows, go to sleep at an appropriate time, and then you can wake up refreshed, take a shower, eat a good breakfast, maybe drink some coffee, and leave a little bit earlier. So maybe if you want to, you can listen to your lecture on your way to school. Listen to it while you're sitting in the parking lot, and then you can find your seat when you get there and just kind of relax before it's time to take your test. So thank you for making it all the way to the end of this video. I really hope that you were able to get some kind of information out of it that will allow you to be successful when you're taking your exams in nursing school. Nursing is hard, but it's not impossible. And yep, you can. See you next time.